is organized by the Faculty of Political Sciences of the University of Jember in collaboration with RCE ESD, Regional Centers of Expertise on Education for Sustainable Development of East Java, which is still candidate, and RCE ESD is Kalimantan, Indonesia, and co-hosted by RCE Srinagar, India. Our utmost gratitude for you all for attending this international web seminar. And my name is Fitri, and it is such a great honor for me to be the master of ceremony for the event today. So distinguished guests and honorable ladies and gentlemen, now would like to kindly invite the Dean of the Faculty of Political and Social Sciences of the University of Jember, Professor Hadi Prayitno, to deliver the welcome address and also to officiate our today's international webinar. Please kindly welcome Professor Hadi Prayitno.
Thank you, Ibu Fitri.
You're very welcome.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, everybody.
Good morning.
The Honorable Director of the Jember University, Dr. Iwan Tarunan, Engineer Engineering, the Honorable Head of National Disaster Risk Reduction Indonesia, Lieutenant General Doni Munardo, the Honorable Head of Disaster Management Education and Training Center, Berton Suar Pelita Panjaitan, PhD, the Honorable Vice Chairpersons of Uttar Pradesh State Disaster Management Authority, India, Lieutenant General R.P. Sahi, the Honorable Director of Social Protection of Victims of Natural Disaster, Minister of Social Affairs Indonesia, Mr. M. Shafi Nasution, the Honorable Mr. Ruichi Nusaki from RCE Hyogo Kobe, the Honorable Secretary to Telnet Forum, Dr. Yoshinobu Fukusawa, the Honorable Mr. Abdes Kumar Gangwar from RCE Srinagar, the Honorable Ms. Yun Sunbai from RCE Dobonggu, Republic of Korea, the Honorable the other RCE representative from each region, the Honorable representatives from United Nations University, Institute for the Advance of Study of Sustainability, and the brilliant attendees who have joined this webinar. Welcome, University of Jember. First of all, allow me to say how pleased I'm seeing all of us gathered here for this international webinar. I would also like to express my sincere appreciation to all of you who have generously helped us making this event such a great success, especially to all speakers, the RCE Global, East Java RCE candidate, and Director of the University of Jember. Congratulations on your well-deserved success. Ladies and gentlemen, mitigation of disaster risk is a problem that affects all dimensions of human life. Many disasters can be avoided or prevented by raising awareness of disaster risk mitigation. Each country must carry out disaster risk management through innovation and infrastructure in line with SDGs 9. On community and government level, in line with SDGs 11. Each country should also connect disaster risk reduction management with environmental sustainability and climate change in line with SDGs 13. Knowledge and information about disaster also help people to be always reading and facing disaster. During the COVID-19 pandemic, it is difficult to handle the risk of disasters. It is also a hinder measure to control this pandemic. The reduction of risk disaster during an epidemic situation requires collaboration between the government and society. In this webinar, various conditions and policies of disaster risk reduction and management from several countries will be explored, especially in this COVID-19 pandemic. Through this webinar, I hope that all participants will receive insight regarding disaster risk reduction and management, especially during this COVID-19 pandemic. Finally, I wish you all the best for your deliberation in this international webinar. and I particularly hope our honorable guests and participants from abroad a great day. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Professor Hadi.
Thank you.
Coming up is the keynote address that will be delivered by the Head of Center for Education and Training for Disaster Management, Bapak Berton Suar Pelita Panjaitan, PhD. And before we welcome Dr. Berton Panjaitan, I would like you to read his short CV. So, Bapak Berton Suar Pelita Panjaitan, PhD, was born in Marihat on the 5th of October 1969, and he started to serve for his current position on the 1st of April 2020. And he obtained his bachelor degree from the Faculty of Public Health, University of North Sumatra, and his master's degree is from the University of New England, Australia, with a major in health management. And his PhD degree is from the University of Canterbury, New Zealand, with a focus in hazard and disaster management. And currently, he is the head of the Center for Education and Training for BNPB, or the Indonesian National Disaster Management Agency, which is a center in charge of implementing the endeavors to improve the knowledge and skills in disaster management. Okay, so now, please let us extend our warmest welcome to Bapak Berton Panjaitan, PhD.
Thank you, Mbak Siti.
You're very welcome, Bapak.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Salam. Om Swastiastu, Namo Buddhaya, Salam Sejahtera. A very good morning for all of you, keynote speakers, and all participants of international webinar on disaster risk reduction preparedness, COVID-19, and sustainability. Your Excellencies, ladies and gentlemen, it is deeply regret from Lieutenant General Doni Munardo that could not join you in this important international webinar because he has a duty to apply today. Mr. Doni has appointed me to deliver his opening remarks. To start with, I would like to mention that the world is sick right now and it needs cure. As you may know very well that we are facing pandemic COVID-19. This pandemic was blowing our mind. It has rapidly brought to the people huge impacts on the way we lived. Not only sufferings, fears, deaths to the population, but also the pandemic brings wider impacts such as reverse economic growth, financial disturbance, as well as the increase on the unemployment. Indeed, a lot of scientific facts that have warned that the governments all over the world related to the potential communicable disease before the pandemic. However, inadequate actions had been taken. Unfortunately, today's action seems insufficient due to magnitude of the problems. The governments had invented in much little to health system in their countries, because it is very obvious that the governments were not ready for any pandemics. Many of the most vulnerable have already suffered terribly due to lack of government's investment in healthcare. Healthcare workers around the world are risking their lives to provide care without proper protections and essential medical tools. Besides, we are also suffering for various disasters due to the presence of natural hazards. More frequent and severe disaster events occur anywhere in the world right now that create other huge problems. Throughout the years, we have met so many people have lived through cyclones, wildfires, tsunamis, floods, earthquakes, and tornadoes. Many of development are swept away in seconds. This uninfected and sudden disaster had kept several years of increasing losses in which each major disaster seemed to do more damage and cost more than the previous ones. Disasters have killed a lot of people, left thousands of injuries, and hundreds of thousands homeless every year. Indonesia is one of the many countries in which disasters are frequently occur. Indonesia lies on the above of Eurasia plate. This plate has joint points with very active plates, namely India-Australia plate, the Pacific plate, and the Philippines plate. Continuous active tectonic processes have created joys and suffering to the people of Indonesia. There are 127 active volcanoes, or 13% of all volcanoes stay in Indonesia. The expert just found several active faults, and now we know there are 295 active faults in Indonesia. Those factors makes over 80% of the total population in Indonesia are exposed at least one disaster hazard. Over 3,800 disasters occurred last year, and have economic loss over 81.8 trillion Indonesian dollar rupiah. In this chance, I'd like also to mention some cure for the word sickness. First of all, is discipline, discipline, and discipline. We all understand that using facial masks, doing social and physical distance, and washing our hands are the main prevention methods to avoid COVID-19. However, many of us are incorrectly do this simple way. A very recent survey in Indonesia indicate that only 82% of the total respondents using proper masks. Those who are disobedient, about 20% were found on the roads, on the public roads. 80% on their phones, and 80% on the restaurants. 50% on the sports center, and 11% in the traditional or modern markets. There are only about 76.9% of the respondents avoided the crowds. Those who visited the crowds are about 16% found in the restaurants, 60% found in sports centers, and 40% on the crowded roads, 40% crowded house or families, and 30% in tourism destination. Furthermore, the institution should also adhere to division of some important facilities to the public. Only 86% of the institution provided hand sanitizer facility, 82% provide hand sanitizer, and 77.7% the institution socialized health protocols. There are about 17% of respondents said, I never get infected by COVID-19. Discipline is an ultimate action to provide a facial mask, social and physical distance, and regular hand washing. This discipline is also applied to other disaster hazards. Make people disciplined could need strong legal and regulation aspects. The second thought that I like to say is how to mainstream DRR concept for all. Disaster urgently needs specific intention that highlight the escalation and integration of disaster risk reduction actions into early warning system. Indonesia is now in early state of developing a multi-hazard early warning system. This people-centered early warning system consists of increasing risk knowledge, monitoring the warnings, enhancing capacity, and providing accurate, inclusive, and timely capability to the community as well as to all supporting elements. This huge investment and instrumentation will include the programs for the community resilience and household resilience to disaster. We call them Desa Tangguh Bencana and Keluarga Tangguh Bencana. The involvement of all stakeholders is critically important in order to increase disaster preparedness and awareness. One of the elements that we need to involve is empowering the young people in measures of disaster management. The young can be also victims to disaster, but at the same time, they also can inspire how to tackle of the problems and provide solutions. For example, fighting climate change and building resilience could make the young people not only disproportionately affected by the impact of disaster, they might be among the first responder in the emergency. They are among the communities to help even before officials arrive. Therefore, youth engagement should be integral part of the framework of disaster management as well as agent for change for disaster. Nowadays, the young are already providing leadership, entrepreneurship, and innovative solutions to reduce disaster risk. Lastly, modern and traditional technology or methods can be jointly used as solution to our problems. Industrial Revolution 4.0 technology is a very powerful tool to provide quick, accurate information to the community. However, this technology could not reach the grassroots if their traditional way of life is forgotten. Therefore, it is important to blend traditional and modernized technologies as complement one to another. Yet, it is also a huge challenge to have this combined technology at the same time to elevate property. Academics and scientists are encouraged to make continuous endless innovations. Your Excellency, ladies and gentlemen, this may be the time for you all scientific experts gathered together to discuss various insights, findings, methods, and innovation in order to make this world better. The government of Indonesia is always willing to have new methods and innovation as well as insights to solve our problems. BNPB is involving various efforts in order BNPB has clear understanding of COVID-19 pandemics as well as other disasters. Have a nice conference to all of you, and your brilliant ideas and opinions are needed. Thank you very much, and big appreciation for all parties that have been participating to this international webinar. Wassalamualaikum warahmatullahi wabarakatuh. Salam Tangguh. Thank you very much.
Thank you very much. Salam tangguh, Bapak. Okay. Thank you very much, Bapak Dr. Berton Panjaitan, for the utterly insightful address. Okay. So we would be really delighted if you could stay with us for the rest of our agenda today. However, we would sincerely understand if due to your tight schedule, if you have got to leave our webinar early. And we would like to extend our uttermost gratitude for you for attending and delivering for attending our webinar today and for delivering the really insightful keynote address. And we wish you a very good health. And once again, thank you very much. Thank you. Excellencies, distinguished guests, dear ladies and gentlemen. So to provide us with information regarding our webinar today, Bapak Eko Ernanda will deliver his talk in our next agenda, webinar at a glance. Bapak Eko Ernanda is the representative of RCE East Kalimantan, as well as one of the senior lecturers at the International Relations Department of the University of Jember. And he is also going to chair the next session of dignitaries' addresses, in which we are going to have a lineup of dignitary speakers who will talk about resilience against disaster in the point of view of their particular context. Okay, let's warmly welcome Bapak Eko Ernanda. So, time is yours, sir.
Hello, Iko.
Oh, I'm sorry.
Yes, time is yours, Pak Eko. Time is
Sorry,
yours.
yes, thank you.
Thank you.
Thank you for
very
the kind
much.
of introduction, Ibu Fitri.
You're very welcome.
Yes, thank you, ma'am. Sorry, I forget to unmute the speaker. This is a technical
Okay.
problem always.
Okay.
Very good morning all, Pak Dekan, Pak Rektor, as well as Pak Berton, who are representing Pak Doni this morning in our webinar, and all the speakers, especially who already joined us. There are Dr. Abdis here, and then from the RC Kobe, from the Korea, Yunsun Bay, and then let me read one because I don't remember. Okay, from the Uttar Pradesh State Disaster Management, Lieutenant General Sahil. Good morning, sir. Abhishek already joined us. And then Mr. Ruichi Nozaki from UK Kobe, and then Director of Social Protection for Victims of Natural Disaster, Ministry of Social Affairs of Indonesia, Mr. M. Safi Nasution, who I believe that this morning will be representing by one of the deputy, Ms. Ida Kurniasi, and then Secretary Telnet Forum, Dr. Yosinibu Fukusawa, and we have a special guest this morning, actually, who going to join us as well from given some comment because he has long working together with the Indonesian government in terms of maintaining Taruna Siaga Bencana, given training and cooperation between two countries, Indonesia and Japan. Mr. Igarashi-san, I think. Good morning, all. Are you already in the room? Hello. Am I got right? Okay. I believe everyone already can hear my introduction very short. Later on, I will chair this session. Before we going to discuss further, there are in Indonesia, especially I will pick up one case in terms of the disaster risk reduction. And we're looking at the disaster, then there is a two cluster important that we should know. I think everyone already know. First of all is about how to mitigate the disaster, and the second one, the most important, not really, I mean, this is very important too. It is how to minimize the victim. So how to make the more resilient community based on disaster. This is very also important. So there is a cluster 2, what we call it. So if there is a disaster happen, then usually volunteers and then many people turn up to help each other. Then as follow with the protocol that been designated by the government in terms of how to evacuate, in terms of how to provide the logistic supply, and so on and so on. This morning, we were very lucky, then very fortunate that we have expertise and as well as the practitioners of the how to maintain the disaster across the Asia Pacific countries. They are from India, from Japan, from Korea, as well as from Indonesia. And without further ado, I think I will call the first speaker to give us his to open our horizon this morning. The first speaker is I'm going to call Excellencies Mr. From Uttar Pradesh State Disaster, Lieutenant General RP Sahil. And before that, I'm going to read his short CV so we can know him very well. Lieutenant General Ravindra Pratap Sahil, Artificial Seva Medal, superannuated from Indian Army after serving almost 40 years in April 2006. On superannuation, the General has been appointed as the Vice Chairman of Uttar Pradesh State Disaster Management Authority. The organization is headed by the Honorable Chief Minister Sri Yogi Adityanath. General Sahil contribution to the state Uttar Pradesh of India has been the effective management of disaster in the state of Uttar Pradesh. It is only after his appointment that the awareness in people of Uttar Pradesh has increased in the field of disaster management, as also the confident in Uttar Pradesh State Disaster Management Authority to steer the affected people out of any type of disaster of hazard. Oh, okay. Without ado, time is yours, Mr. Lieutenant General. Good morning, General Sahil. I think you already joined. Abdis, can you help to contact him? Oh, I think we seem to have trouble with the connection at the moment with the General Sahil. So I would like to call the second speaker, I think, is Mr.
He's just there. He's coming. He's coming.
Oh, he's coming? Okay.
Lieutenant General Sahil is the head of Uttar Pradesh State Disaster Management Authority, and the state of Uttar Pradesh is larger than many countries world over. It's a huge state. 1/5 of India's population is in Uttar Pradesh, and a very dense population. That's another challenge, and it's a multi-disaster prone state. So making Uttar Pradesh disaster resilient means making India disaster resilient. And Lieutenant Sahil has been doing brilliant work to make Uttar Pradesh disaster resilient.
Okay.
He's just joining us.
Dr. Abis, before General Sahil given his presentation, I think it's better if I call you to explain, because you do some questionnaire to the RC members. Is that fine for you if I give you first place to explore the result or whatever the idea that came from your survey.
Just call him again if he's there. Okay.
I think it's not ready yet. General Sahil?
Yeah, I'm in. Good morning to you.
Good morning.
Sir. Good morning, sir. Please go ahead. Yes, sir. Please carry on your presentation.
Good morning to all the participants. I'm Lieutenant General R.P. Sahil, Vice Chairperson, Uttar Pradesh State Disaster Management Authority. And I send you my greetings on behalf of the Honorable Prime Minister, Honorable Chief Minister, and all citizens of the country. Great honor to be on this webinar, and here I start. Ladies and gentlemen, I would like to say that as far as India is concerned, the key sentence which we used to carry out the disaster risk reduction, rather I'll say disaster risk management, is preparedness is the key to manage disaster. That is, as far as whole of country and Uttar Pradesh in particular, we have been following this principle that we need to prepare ourselves to take on any kind of disaster which is likely to follow, or especially in this year, we went through a pandemic. Still, it was only that keyword, the preparedness, which started very early, that has seen us through. And as I go along, I will explain you how we went about and what has been the result and how we still continue to take on this pandemic and ensure that there is a minimum loss of life and property. With that, this year International Day for Disaster Reduction is all about governance. And I tell you, as far as governance is concerned, right from the Honorable Prime Minister's directives, and especially I'll focus my talk today to pandemic, as also the other hazards which generally face India during monsoon period. Therefore, we started as early as February, no sooner the case was detected. And thereafter, it has been followed in letter, spirit, as also the public cooperation, the cooperation by each and every individual of the country has been tremendous, and we have been able to keep the pandemic well under control. And as I was talking of the governance, and therefore, the governance requires national and local strategies for disaster risk management in place by end of the year. And therefore, it is an ongoing process. We carry out these certain actions, carry out a mid-course correction, and then follow it up once again, whatever either was felt that needs to be done, or whatever was felt to be dropped. As far as we are concerned, and being the member state of the Sendai Framework of Disaster Risk Reduction, which was held in 2015, we follow it in letter and spirit. Good national and local strategies for disaster risk reduction must be multi-sectoral, linking policies in areas such as land use, building codes, public health, education, agriculture, environmental protection, energy, water resource, poverty reduction, and climate change adaptation, which is most important. Because as I go along, I explain to you, as far as India is concerned, and Uttar Pradesh in particular, the preparation for the DRM, Disaster Risk Management, carries on throughout the year, and we start focusing as and when that kind of a periodic disaster or hazard is likely to take place. For example, when the monsoons come, our preparations are completed by 15 June. And thereafter, we see through this hazard till the time it lasts in the year. And as of now, as I tell you, we have already started preparing for the cold wave. So therefore, it is an ongoing process throughout the year. We are continuously monitoring the climate change, its effect, and thereafter putting the disaster risk management issues in place. You all know disasters disrupt progress and destroy the developmental effort. And that is where our focus is. Okay, while the development efforts take place, we push in the disaster risk management issues within that developmental project. And that's the stated policy at the national level. And Honorable Chief Minister Yogi Adityanath has very emphatically laid down that this will be followed in letter and in spirit. And we are exactly doing it on the ground. And efforts our efforts, which we have put in since last 2 to 3 years, are now getting reflected on ground with total improvement in the disaster risk reduction as well as the developmental plan. Therefore, this is a dovetailing of the two important issues. While developmental plans takes place, at the same time, the disaster risk reduction also continues. There has been a drastic reduction in the casualties or people suffering, which has come down basically because of this all multifaceted approach which we have adopted in the state of Uttar Pradesh. Coming on to the specific COVID-19 challenges in India and Uttar Pradesh. Our Honorable Prime Minister laid down a roadmap to climate resilient and sustainable development, and in that he highlighted the 10-point agenda. And we in the state of Uttar Pradesh, under the directions of Honorable Chief Minister, we are following it in letter and spirit from point number 1 to point number 10. And that possibly made us withstand the, you can say, the kind of a damage which this pandemic could have caused in our country. We are 130 crore people. And therefore, I think, had we not started early, had the Prime Minister not sensed it, that this pandemic is about to create havoc in the country, today our results are for the world to see that in spite of this heavily populated nation, when the population densities are very high, especially in the state of Uttar Pradesh, we have not only managed it, but I think we have brought it totally under control. And we hope to see that we keep this under control till the time the vaccination or the medicines for its treatment come about. And I assure you that as I go along, I'll cover this aspect as well. The first case of COVID in India, which originated from China, was reported on 30th January 2020. And as early as 2nd February, when the second case was reported, our Prime Minister immediately thereafter took a note of this pandemic to follow. And he issued his instructions. And thereafter, a series of instructions which emanated from the Government of India, Lockdown 1, Lockdown 2, Lockdown 3, continued with various instructions. And why Lockdown 1, 2, 3? Because we used to take a stock of the situation. Additional issues were pushed in. The issues which needed to be dropped down were dropped down. And that is how a cycle was maintained from lockdown number 1, 2, 3, and so on and so forth. Now I'll come to the specific issue of the migrants. What happened? That immediately after this pandemic commenced and started showing signs, a lot of people started, who were working in other states of the country, they started moving back to the hometown, respective hometowns. And there was a little movement which activity took place, and because the lockdown had already commenced. But notwithstanding all that, I think the actions which were undertaken both at the national level and absolutely at the state level, we were able to pick up the migrants from respective places, and especially if they had already they were on the border of the Uttar Pradesh, every migrant was taken care of. He was given food, shelter, medicines. Children were taken care of, and they were shifted to their hometowns wherever they wanted to go back under arrangements of the state government. And I think I assure you that while the movement took place, we didn't suffer a single casualty. And I think everybody raised home safe and sound. And that is the, you can say the parameter on which if we have to grade that everybody who started from wherever he was working reached home safely and in a sound condition, I think that speaks of the management, of the transport, of the medical facilities, of their, you can say, their clothing, of their food items, whatever was necessary was provided, and they reached the home safe and sound. The interstate migrant force, which represents the lowest paying and most insecure job in key sectors such as construction, hospitality, textile, manufacturing, were left wondering what would happen to them. The UP government has provided all necessary support like food, transport, security, and some people who couldn't wait for the system to support were given en route care, support with medicine and transport till their doorstep. Thereafter, the government of Uttar Pradesh carried on with its effort to ensure that minimum damage takes place because of the onslaught of the pandemic. And in that, the first very thing what happened was online registration and skill mapping of all these migrants who came back. What are their specific role? What are the specific jobs they are doing? What is the level of competence in this thing? And thereafter, we have started Kaushal Vikas Yojana under the directions of the Honorable Chief Minister, which has ensured that within about 2, 3, 4 months, whatever was possible, they were made to graduate onto the next level of the skill. And all this was only possible because a massive drive we carried out. Each and every person was mapped, his location, where he was working, and all possible details were available to the state government. And that is why this policy has been a great success as far as Uttar Pradesh is concerned. And I tell you today, a lot of people have gone back to the respective places of their work from where they started. So that is the indication that the government of Uttar Pradesh, when they were coming in from their respective places of work to their hometowns, were taken care of. The rations, any kind of facility was given to them. We carried out isolation. We carried out all possible these things so that the spread of this disease could not take place. And again, the people who suffered, whatever people were expecting, and possibly we have gone beyond that to ensure an extent helping hand. Now they have gone back. They are also facilitating their movement to go back to their respective place of the work. However, the aspects of the precautions to be taken as far as COVID-19 is concerned continues. The 4 to 5 issues which need to be is being addressed upon. Even now, in the towns, villages, through newspapers, through miking, and these people, when they are going out, are also to follow all the precautions to be taken as far as COVID-19 is concerned. India was taking precautions to curtail the spread of coronavirus from issuing travel advisories, introducing temperature screening of foreign travelers at the airport, and establishing quarantine centers to being one of the first countries to ban international and domestic travel. These measures significantly paid off, and resultant was the kind of spread of the pandemic was reduced in numbers as also in the dimensions. Not a competition, but we took care of the citizens of our country by restricting not only the movement within the country, but even the foreign travelers. India undertook one of the boldest measures ever seen by implementing a lockdown of over 1.3 billion people to break the transmission chain of virus. Now, that is some unimaginable figure and unimaginable results to be achieved. It was only possible because of early decision-making process, sustained by the implementation of the directions, and whatever mid-course corrections were required, they were done, duly supported by each and every individual, each and every citizen of the country, each and every government organization, and even the non-government organizations also came up with a lot of help. And as a nation, we took it on a award footing, and that is where we are successful in initially controlling it, and thereafter we have been able to maintain it well within this thing. And simultaneously, what we did, that the medical infrastructure kept on improving day by day, whether it was number of beds, whether it was the kind of facilities which are being offered to the people who were suffering or initially with the migrant laborers. And therefore, we were totally in control of the whole situation right from the time of arrival of this pandemic and even till date. And we continue to still keep doing better because the medical facilities have now come up not only to the desired level, but we have certain spare capacity in which we manage from even people from one state to another or one district to another. This is only possible because of the infrastructure which have been developed.
You have 10 seconds to finish your presentation, sir. I'm sorry.
Okay, I'll just sum it up. And there is a lot of other schemes which we have started at the national level and at the, you can say, state level. I'll just name the few. Mahatma Gandhi National Rural Employment Guarantee Act. Now, this provides employment to each and every individual in the villages. And similarly, now we have started to provide the same facility of the vendors of even these rickshawalas and the people who drive autos and all. The government has gone on to the complete employment guarantee to be given to each and every individual of the country. And therefore, I'll say that Atmanirbhar Bharat scheme, a lot of schemes have come up, a lot of opportunities are available to the young people to take on the finances, the loan available from the government, interest-free loans are also available to start their own entrepreneurship. And as far as COVID-19 is concerned, it's well under control, and we are doing very well because of the honorable directions of the Honorable Chief Minister, spreading awareness about the disease and implementing it ruthlessly. Initially, there were little issues. People did not understand the, you can say, dynamics of the whole thing. But within about 5 to 7 days, they understood the requirement and they also cooperated. And there was no hiding of symptoms. Anybody is coming, this thing, and all small items were made available at the lowest level, even to the families, like oximeter and such like items were provided. Emphasis on disciplined living to avoid 19 after unlocking of the state, and economy has started reviving. Now, the best example is that today we stand, the economy's revival has started. And all this is possible because of the policies which we interjected by the national government, totally followed by the state government with a little tweaking here and there due to the requirements at the local level. And with that, I think my time is there. I have a lot to talk about. Each and every policy can be spoken for almost 1 to 2 hours. But suffice to say that these policies which are emanated from the center by Honorable Prime Minister were totally adhered to and followed by letter and in principle by Honorable Chief Minister, and implementation was also monitored and mid-course corrections carried out, emphasis revisited, and focused areas from, you can say, to where required was also changed depending upon the number of cases which are emanating. And today we are in total control of the whole situation, duly supported by the medical infrastructure which has been developed. We are fully prepared to take it. And this is possible only because of the paradigm shift in pre-disaster actions, the preparedness to the earlier concept of post-disaster reaction. So it is the action which has come in, and reaction, we don't have to look back on this thing. That is a old saying. Today, the Government of India, Government of Uttar Pradesh, under the able guidance of the Honorable Chief Minister, we are following this concept of pre-disaster action preparedness. Preparedness is the key word for the development and the disaster-making plans. Thanks for giving me this opportunity to present views of the state government. And if there are any questions, I'll take that.
Thank you, General. Thank you for kind of very fruitful information that you give it to us. I believe there is a lot of question, and myself, maybe if you can stay with us for maybe until finish the session, so that we can discuss more further what you been presented. But the big question actually, as Dr. Abis mentioned, that the Uttar Pradesh is a very big state in India, and I believe that the complexity of the how to manage the disaster is a kind of the problem as well. So maybe we keep in later on in the discussion how you simplify the process and how you deal with the sustainability challenge in terms of the minimizing reduction of the disaster. Okay, next speakers. We'd like to invite Mr. Ryuhi Nozaki from RCE Kobe. Before we start, I would like to introduce Mr. Ryuhi. He is chairman of the Kobe Matidukuri Institute and the former representative of Yogo NGO Network. He is expert volunteer and of reconstruction in disaster-affected areas in the Great Hanshin Awaji earthquake in 1995. Now he is a consultant for ordinary community building. Okay, time is yours, Mr. Nozaki.
Hi, all participants. My English is not so good, so I start to speak. This report, I'm a practitioner at Great Hanshin earthquake. As a practitioner's point of view, I report my experience and lesson I learned. And after Hanshin, I also support some disaster area in Japan. Yes. Okay. And yes, in 1995, we had Great Hanshin earthquake. Since then, we have no experience after World War II. We must start from 0 point. And at that time, very big chaos happened. And through this situation, we start to reconstruction. Yes. This is a central Kobe area, damaged, most heavily damaged area. Yes.
Next slide.
And I myself an architect. So as an architect, I join in housing reconstruction project. Yes. And at this time, in Japanese, condition is the centralization of power is still going on. So local government and citizens who are damaged, they try to keep initiatives their own. That's very, clear point, yes. And local government doing, they have their own principle, and it becomes 3 points. One is they established reconstruction fund. The fund is after some kind of, not a good word, money laundering. Fund consists of public money. That doesn't consist of public money. So near to public money, it's very easy to use to come across many needs. Yes, that's 1 point. And local government gathers victims and supporters meeting. Usually, government meeting consists of expert or researcher, that kind of people is main. But this time, half of this member is victims and supporters. That's very important point. And also, third point is specialist dispatch system we built up. So to support sufferers, victims, initiatives, it's very important. Yes. And city of Kobe is a pioneer of this kind of system. So it spread all damaged area. Yes. And soon after earthquake, many networks had came out, NGO and volunteer, and also a local university and college network, and also a specialist organization. It takes a little time. Specialist means lawyers, architect, tax account, and other people. Yes. Because for reconstruction, these various kind of specialists must work together. So organization make network. Yes. And my activity is, as I said before, I'm an architect. So we make Kobe reconstruction team. After earthquake, there are many meeting and discussion are held in cities. Every day I join this kind of discussion. And after 2 or 3 months, I met many people who had same mind. And naturally, they gather, and then this team had established. Yes, and this team discussion, and after that, many proposals to city municipal office or prefecture. Yes, and these proposals came real many times. Yes, and the other hand, I joined many housing reconstruction project. I myself 5 damaged condominium reconstruction, and 4 joint housing. Joint housing is a cooperative housing project. Yes. And last 2 collective housing. Later, I explain about collective housing. This is a Kobe reconstruction team went to San Francisco to see the non-profitable organization activity. Yes, this participant is a researcher and government member, and also reconstruction activity joint people. Yes, it's a very good observation for us. Yes. And this is damaged condominium. This one is most tragic case. Yes, it contained 178 families, partly heavily damaged. So they have many, 2 different kind of opinion have come out. Rebuild and restrain, yes. And so this discussion finally occurred soon. And during judgment, it takes more than 10 years. So they cannot come back to their own house, new own house, for 13 years. This is the most tragic case. So, and I am a consultant. As a consultant, I joined this project. Yes. So I learned this tragedy. I made up my mind to build better condominium again. Yes, and this is one of project. This project in Asia, and this is collective housing. This house have exchange space inside this building, and 17 family live there, and in interaction and cooperation like virtual relatives. They are living in now here. And I explain this family why this kind of building I made. And after life is start, for 2 years, I join and advise how to live, how to use this building. Yes. And it's very successful. This is a recent photograph. About 5 years ago, we had a Christmas party. All members gather and have celebrate Christmas party. Yes. And that is my experience and my work in Hanshin earthquake. Since then, I go into East Japan earthquake. As you know, tsunami damage is very big. And since Hanshin earthquake, it takes 16 years, and the Japanese condition is changed. And centralized political power is become more strong, and centralization is going on. So local government is become, their power is very small. Yes. And
Your time is 1 minute left. I'm sorry.
okay. Okay. So yes. So okay. These are my activity in this area. Yes. And this report, I want to say, as a practitioner, people's initiative is indispensable for sustainability. And reconstruction era is very short. After that, they have their own recover. So as a supporter, I think they need no support. They need empower is more important, I think. And always we must think sufferers' initiative is first, I think. Thank you. That's all.
Thank you very much. Thank you. Very timely.
Thank you.
Mr. Ryuki Nakazi. Yes, I hope you can still join us until we finish the conversation. And there are some questions that remind that we could to be on your experience, because you mentioned about something social change of the recovery. This is very interesting. So this is from the point of, from the volunteer based point of view. It's quite different with the perspective from General from Uttar Pradesh. I think this is kind of a community-based decision that need to be more explored in the discussion. Thank you very much.
Thank you.
Then I would like to I would like to move to the next presenters. And I call upon Ms. Ida Kurniasi, who representing the Director of the Social Protection of Victim of Disaster from the Ministry of Social Affairs. Ms. Ida Kurniasis graduated from Master of Development in Melbourne University, and they hold a bachelor degree from University of Indonesia, specialty in social welfare studies. And she currently working at the Ministry of Social Affairs of Republic Indonesia at the Directorate General of Social Protection and Social Security, and specialty in disaster affected people as a head of section of social strengthening after disaster, and at the Sub-Directorate of Social Recovery and Social Strengthening after disaster. So I believe that Ms. Ida has a kind of a wide experience in terms of dealing with the disaster in Indonesia and dealing with how to build community-based resilience. If in Indonesia there is, we call based on villages, we call it kampung tangguh, or strong village, and basically they make it more people in the village more have a preparedness, readiness to when the disaster occur or happen. Okay, Ibu Ida, I think you're already in the room and time is yours. Thank you very much, Ibu.
Thank you very much, Pak Eko. And if I can please ask one of the, okay, that's great, the host to share my presentation, that would be great. Thank you very much. So I would like to share our presentation on the supporting community in disaster risk reduction through a people-centered approach. And first of all, I'm here to represent my director, Bapak Shafi Nasution. As far as he is very keen to join this webinar, however, unfortunately, he has another agenda at the same time today. So he apologized for not being able to attend this webinar, and he sent his regards to all the participants. And please allow me to present this on behalf of the Ministry of Social Affairs. All right, I'd like to start by, can we go to the next slide, please? I'd like to start to present a brief of some of the key directions at the Ministry of Social Affairs regarding to the disaster management and in terms of social protection in particular. As it mentioned, that my presentation will be focusing on how we deal with risk reduction, but focusing on the community and the people itself, and how we build a stronger and more resilient community towards some of our programs. So the ministry has committed to develop community-based disaster management, or we known as the CBDM, in more comprehensively, and then we also committed to expand the coverage of our social protection in disaster management and accelerate the basic needs fulfillment for disaster affected populations in terms of psychosocial support, and increase the capacity of human resources in disaster management in sustainable manner. And we also want to improve the logistic management system that we currently have. So those are the basic sort of like policy directions that we try to develop and is, bringing down to some of our projects and programs. Next slide, please. Yeah, so I'm going to start with we have two main community-based risk reduction and preparedness programs within the ministry. First is the Kampung Siaga Bencana, or a disaster prepared village, or we call it KSB in abbreviations. We are aware that communities have so much capacity and resources that it could be useful to prepare themselves in dealing with disaster or any other kind of emergency situations. And we thought that by increasing their capacity, we also reducing their vulnerabilities. So we try to facilitate the community by forming this KSB we facilitate them through focus group discussion or community consultation, and we allow them to form an emergency response committee. So they have sort of like task division and organize themselves, divide the team, and mapping out the risk analysis as well as the contingency planning to know what are the resources that are available within their community and the environment, and how to use that in times of disasters. So they are better prepared when they have to deal with the future disasters. And then we also facilitate them to do some of the simulation exercise. This usually done regularly. And then we also provide support for pre-position logistic in their community warehouse. And it's not only be done by one time, so we provide it actually 2 times, but then we expect them to continue and to provide more logistic using their own resources or networking, especially in the private sector or other local non-government organizations that are available in their areas. And then we also want to expand the program at the moment, so it's not only cover one village. Actually, now we call it Kawasan Siaga Bencana, or area-based disaster preparedness program. So the area consists not only one village, but expanded to several villages, put it together. And we have launched in Kulon Progo, Yogyakarta, just in late August this year. And then we expect that by developing the program, we can increase the capacity of community to deal with future disasters. Next slide, please. And the next one is Tagana, or Taruna Siaga Bencana, or known as disaster volunteers. As we know that one of Indonesia's greatest capital, in particular social capital, related to humanitarian is the spirit of volunteerism. We can see that during disaster, there are many actors, many people who act quickly and came to help the affected population in order to reduce this suffer. And it's just like happened very responsive, and it's very helpful for the government, for the ministry itself to reach out the community. So Tagana was formed to facilitate those who committed to be a volunteer in disaster. And they are so far is the heart of our disaster response program and has helped us for many activities, from food distribution, logistic distribution, or providing shelter, wash, or even the psychosocial support. They came from various backgrounds, such as teachers, doctors, or even motorcycle taxi drivers. And I have to admit that MOSA itself couldn't work without the participation of this volunteer, which has reached now more than around 18,000 of the volunteers. And they've been very enthusiastic, helping us to reaching out the community and provide all the aid distribution in more timely manners. And one of the innovation, and as part of integrating the disaster risk reduction in education, we have now launched the Tagana Goes to School program, which aims to create awareness for some of the students. So Tagana will come and visit some of the schools and give us, like an information and education session to the students about raise awareness and what you have to do when disaster happens. Next slide, please. And so with these two, our major programs in community-based disaster risk reductions, we try to promote and support more by some of activities. One of them is a capacity strengthening. So when COVID strikes, we receive many requests of the capacity strengthening for our volunteers on how they can perform their tasks in supporting people during this pandemic situation, and also to assure the safety of our volunteers, not only for themselves, but also their families and also the community that they helped. So MOSA conducted virtual online training in collaboration with its partners such as WFP, IFRC, Red R, UNICEF, IOM, Tear Fund, WHO, OCHA, and many others experts from the sectors. And then the training covered numbers of topics such as humanitarian principles, health protocol, especially in COVID pandemic situations, and guideline on humanitarian workers and volunteers in COVID-19, coordination, shelter, wash, camp coordination, and camp management, nutrition, and also our two major programs, Tagana Goes to School as well as the KSB. And the training has been conducted for 6 provinces, and we are aiming to cover all the provinces. So far, we've done for the East Java, West Java, Central Java, South Kalimantan, East Nusa Tenggara, and Banten. So we expect within the following months we can do in the rest of the provinces in Indonesia. We're also trying to develop with some models and online platform which will allow this Tagana to do their self-learning and to make it more systematic and structured, as well as to make it more accessible for them to get all the resources they need, information on how to be prepared in, helping the community with this COVID-19 situations. Next slide, please. And then we also have some guidelines to support the community initiative. We are aware that there are many initiatives performed by the community, but at the same time, we want to make sure that it will be conducted in safety manners. So these guidelines were made in consultation and coordinated with the related partners from the key actors of each sector, in particular within the humanitarian context. And it's a living document, so it's up for any feedbacks or revisions, because we know that we have such a dynamic situation in this pandemic. There are so many changes and information updated, so we committed to make this as a living document. And it provides a starting point. We hope that, if you want to start some initiative within your community, you have this guideline as a starting point, and then to help reducing the transmission of COVID-19 within your neighborhood or your environment or your community. And then, so we have these 3 main guidelines. First is guideline for community-based quarantine and isolation facilities. So we want to prepare community to provide shelter or community-based facilities for quarantine or isolation that is safe, comfort, and dignifying. We are aware that now with the increase of the numbers of the COVID-19 cases in Indonesia, the needs to provide more facilities is also increasing. So we want to make sure that community know how to provide this in a better way. And then second one is a guideline on distribution and cash-based assistance during COVID-19. So we know there are many assistance are provided by many actors for this pandemic. The thing is how to manage and distribute them in accordance to the health protocol issues to assure the safety of community and people who distribute it. And the last one is guideline for humanitarian workers and volunteers in the new era of COVID-19, which aim to provide on how to perform the task of the volunteers in helping the community by adjusting to the current risks to avoid creating further harm and to reduce the transmission of the COVID-19. Next slide, please. And we also have our system and hub of information on response for COVID-19, or we call it SHIRIT. It's an automatic computer program to assist users in finding a quickly and reliable information. And this is also to help our volunteers to access and disseminate a reliable information and avoiding the spread of hoaxes. And then here there are some data regarding to the activities of Tagana in response of COVID. Next slide, please. I'm just gonna go through quickly for the few slides. Can we go to the next slide, please? Yeah, so this is the data has been taken up to 5 October. Basically, there are few numbers of activity has been performed by Tagana in order to help responding to COVID, such as education, socialization, community kitchen, hand sanitizer distribution, disinfecting, health check, social service, and other communities activities. And then it had number of activity has reached 6,900 in 33 provinces. Can we go through the next slides quickly? So this is the distribution based on the province. As you know, that some of the province has more activities. The red one, the red color, meaning that there are more activities compared to the orange and the yellow one. This is on the west part of Indonesia. Next slide, please. And this is on the central part of Indonesia. We have Kalimantan and Java as the provinces who have the most activities. And the next slide, please. And mainly on the east part of Indonesia, there are not as many as in the west and the central provinces in Indonesia, but there are still some activity that has been conducted by our volunteers or Tagana. Next one. Yeah, can we go this is the accumulated data from the beginning of March until October. As we know, some of the activities have expanded, some of it were reducing. It's based on the needs on the community itself. Next slide. Yeah, I think on the October we're more focusing on doing the disinfecting and cleaning, as well as the support the food distribution and community kitchens. Next. And these are the top. Yeah, I'm just gonna have one slide more. The top 5 activities are disinfecting and cleaning, community kitchen, support for crisis center, food distribution, and dissemination of information on the health protocol. Those are the 5 activities that has been conducted. Last slide, please. So I'm going to close my slide with some of key questions for our reflection as a humanitarian workers. We know that disaster has become more complex with all the multi-contributing factors, climate change, increase of the density and population, and as well as what we're facing at the moment, the pandemic. So the question is, are we better prepared to respond to this? The second one, there are still many people who are displaced and living in undignified conditions. This picture was taken from the last flood that happened in South Sulawesi or Luwu. And at the moment, they're still living in a displacement. Houses has been destroyed and they are disintegrated with their livelihood, no access to education and proper health facilities. So the question is, have we changed and increased their risk of awareness? Have we provided enough support for them to rebuild a better and safer environment for them? And then the last one, when we talk about risk reduction, meaning a better planning, not only in the disaster area, but also it should be in all the elements of development sector, as this very interconnected. So how can we integrate more our humanitarian works within the development sector? How can we reduce or even close these gaps? So those are some of the questions for our reflection. And I think I'm going to finish my presentation. Thank you very much.
Thank you very much indeed. Thank you very much indeed, Ibu Ida. That's very kind, very good. Fruitful information and inspiring. As I wish that you can stay still until the discussion finishes, and people, maybe the participant will ask some question. And the same as two presenters, I would like to ask in broader meaning in terms of the the government of Indonesia developed the concept of DRR in terms of the sustainability for the sake of the sustainable development. Thank you very much. The next speaker is Mr. Fukasawa. He is right now is the Overseas Business Department Director in Nishi Nippon Ltd, Fukuoka, Japan, and then he was taken before his current position since June 2017. Prior to that, he served as the Regional Director for Asia and the Pacific, United Nations Human Settlement Program, UN Habitat, from 2013, overseeing numerous housing and urban development initiatives in 32 countries of the region. I think it's very good, very broader, and very huge job it is. And then he right now is he's also serving as the Deputy Executive Director of Disaster Reduction and Human Renovation Institution, DRI, founded in commemoration of 1995 with Hansin Awaji earthquake. He was also engaged in a number of international cooperation initiatives in various governmental positions from 1925 to 1997. He also second to the United Nations Department of Humanitarian Affairs in Geneva, Switzerland, as a relief coordination officer. And from 1985 to 88, to headquarters of UN Habitat in Nairobi, Kenya. And as a human settlement officer in 2006, he founded the International Network of Telling Life Lessons from Disaster and in the application TELNet. An organization 2010 TELNet Forum and 2020 TELNet Forum both in Kobe, Japan. Very long experience in the humanitarian activities, I think. Okay, time is yours, Mr. Fukasawa. 15 minutes your presentation.
Yes, thank you. Thank you, Pak Eko. And good afternoon, good morning and good afternoon to everybody, distinguished the participants of this important forum. Can you put up my presentation, PowerPoint, please? Yep. Coming? No, that's not the one. That is not the one. The middle one, the one in the middle. Yeah, that's the one. Thank you for sharing a long introduction of myself. Actually, you didn't have to go through that, the whole thing. I thank you for inviting me to this important occasion, and I'm happy to share a bit of a presentation in the capacity of the Secretary of International Network of Telling Live Lessons from Disasters, in short, TELNet. That's what I represent in this forum. By the way, Nishi Nippon Railway Company is the place where I receive my income. But I'm also engaged in this kind of activity as on a voluntary basis. Next, please. I have no choice but beginning my presentation with a Kobe thing, which Nozaki-san has already mentioned quite a lot, so I simply don't have to say much about that. Just to remind you that it was in 1995, and over 6,000 people died. By the way, I'm happily surprised to meet with Nozaki-san, whom I know for a long time and with respect. And konnichiwa, Nozaki-san. Next, please. This is where I used to work, Disaster Reduction and Human Renovation Institution, a bit weird name, DRI in short, which was founded in Kobe in commemoration of the earthquake of 1995 and it's a multifunctional functional facility, but among many other facilities, the functions, this exhibition, a museum function is the main thing of this institution. Right after the earthquake, the Kobe Prefecture and the Kobe City organized kind of a job creation exercise to employ people who lost a job and mobilize them to collect whatever things which are related to earthquake, like documents, photos, artifacts, and etc., etc. And 160,000 items have been collected, and out of those, the 800 items are exhibited in this in the RI museum. And this kind of a museum, you may imagine that often the museum displays the mechanism of earthquake and the plate tectonics, etc., which this museum doesn't do. The museum focuses on exhibition of how the people of Kobe reacted to and coped with and overcame the earthquake. And in other words, that is to exhibit how the people felt and people's heart and emotion, in addition to, of course, facts and information. And this kind of information associated with the emotion and heart-to-heart communication has got very powerful messaging power. Of course, there are storytelling volunteers, and if you look at the rightmost picture, which is two plastic bottles, which is actually garbage, you can throw it away, but it still displays that. Why? Because on the first day of the earthquake, the water was a very important problem, and a friend heard of this problem. A friend of the person who donated this plastic bag. The friend heard of the difficulty of the water, and he brought 2 boxes of waters on a bike for a long distance. And the person who received this bottle was so relieved and happy, and he really felt, he was really touched. He couldn't simply forget about this important time, and which is represented by these plastic bottles. Therefore, he couldn't throw it away, and he asked the prefecture to keep those plastic bottles as the memory and record of the earthquake, and the museum now displays that. This is the exhibition of the plastic bottles for sure, of course, but this is also, or even beyond that, the exhibition of the heart, emotion of the person who donated these plastic bags. This is to display the importance of helping each other and be kind to each other at the time of disaster. This kind of thing is being displayed. Next, please. There are many activities of this kind in the world. The Hawaii, Aceh, Thai, Phuket, and in Tohoku area, which was hit by tsunami in 2011, there's a network of existing small tsunami memorial facilities, monuments, individuals. This kind of activities is also taking place. And in Japan, there's even a site where they still preserve memories and pass on the lessons of the event which happened in 1783 when one of the mountains erupted and 2,000 people died. It's a long relay of preserving and passing on the memories is also another good example. And not only museums, but also the various commemorative events, ceremonies and festivals, etc., etc. Some are large, some are small, very expensive, not so expensive, and public, private, volunteers. And they also relay this kind of memory by way of songs and paintings, like artistic work. Next, please. Now, this is it is against this background that this internet was founded. Another background was also the second round of UN World Conference on Disaster Reduction in 2005, which took place in Kobe. The third one, of course, everybody knows, was convened in Sendai in 2015. Against these backgrounds, I was also a part of this conference, and I met several experts from different countries, and we discussed and we decided to set up this kind of network of telling live lessons. And it is an international network of the individuals or institutions in different parts of the world who are engaged in or support various activities of preserving the memories or stories of what happened at the time of natural disasters and passing on such stories to the next generations, as well as to other places than disaster hit areas. And through this network, we aim to facilitate cross-learning with each other, and we also collectively promote the importance of disaster storytelling. Next, please. In this January, in late January of this year, the 2020 Telnet Forum was convened. I was also part of the organizing team, and this is where actually Abdesh Gangwarji also participated. He's right in front, in the very front line of this group photo. And actually, had it been organized 3 weeks later, it wouldn't have happened because of the corona virus. But we are kind of lucky to be able to organize this thing. The forum was convened in commemoration of the 25th anniversary of the 1995 earthquake, and 71 experts came from 21 countries or areas, like everybody, the individuals, museums, researchers, government officials, etc., etc. And next, please. Here is the core of my presentation to just share with you some points discussed during this forum. In short, why disaster storytelling matters. First of all, I go through 3-4 points very quickly. The disaster storytelling has got very strong power in terms of message. Of course, it is said that psychologically, when a disaster survivor tells a story about disaster, that contributes to the healing of psychological easiness of the person himself. But beyond that, the message has got very profound. It creates very profound empathy or resonance between storytellers and story receivers. This is in this way the message or information is conveyed in a very effective way, not as a it's a kind of heart-to-heart level of communication. It's not really a theoretical level, heart-to-heart level of communication. That's the point. And it is not only a useful know-how in a practical term, but rather something deep in our heart, like the way we should live our life, or the meaning of a coexistence with the nature, which is the gentle in a normal time, like a mother, but also exercise a very harsh, destructive, mighty power. And it kills people and destroys things. And this also, this empathy can be a very effective engine to translate the knowledge that you have into actual actions. Or in other words, is to fulfill the last mile of the long journey of this DRR. Everybody, you may know that now I know what needs to be done, but I'm busy today. I do that tomorrow, forever. You don't do that. But if you are exposed to this kind of real story, which motivates you really to implement your knowledge into action, that's another power of this storytelling in our view. And also, it is my hypothesis. Can the power of disaster storytelling be turned to be the power of reconstruction I don't know the answer, but that is a point that I would like to raise. Next, please. And this kind of disaster storytelling does not necessarily happen all the time at any place. In some places like Kobe, it's very active, but in some other places, not so active. Why? And we also need to be aware of the very high delicateness of the local debate as to whether a disaster remains, should be preserved or removed. That's another delicate question. And the other one is, of course, there are many various methodologies of disaster storytelling, and but one important point is that artifacts and monuments can be can talk very eloquently when a small story is associated with those items. Then you will immediately know the meaning of these artifacts and at the bottom of your heart. And so that's a key point. And also the ICT can be a very effective power, like computer graphics and etc. etc. But still, I think we believe that the still story matters and fact matters and place matters. That's probably these two elements need to go hand in hand. And next, please. And museum can play should play a very important role, because disaster story has got very powerful message power. However, it is by definition subjective and about a specific point. However, and just a mere collection of a disaster story is not enough to describe a disaster, which is a complex social process with a large time and space dimension. But museum curators can probably play a very important role in carefully combining systematic knowledge and emotional elements in designing a disaster preservation and to convey the correct message of what the disaster is all about. And also, some people may say, "Oh, museums are expensive. We can't afford to do that." But mind you, of course, like a Kobe thing, it's very expensive. But we do know some good examples whereby the funds are raised on a voluntary basis only, and it doesn't really, mobilize. It doesn't. It's not really expensive. You can do that, and so last point is addressing the fading of disaster memories. We discussed and we tried to figure out how to prevent the fading of disaster memories. But at some point, we realized it's not possible to prevent the fading. The fading does happen. Then how should we cope with that? That's another last point that we need to study. And the next, please. Those are the points that we discussed. I've got two more slides. I've been asked by Abdesh G to touch upon COVID-19 and disaster storytelling. I try to do that, but I probably said the lack of my capacity, and also a bit of a difference between the pandemic and natural disaster. I simply cannot really figure out what it is. I simply refrain from saying much about that. But probably, having listened to the presentations of the previous speakers, the pandemic is a part of urbanization. Not only COVID, but also any other pandemic, where future possible pandemics are a part of urbanization, which cannot be avoided. So, and also disaster happens. That's the last one. The disaster happens, as people say, but probably the pandemic thing also needs to always be taken into consideration in disaster response. That's the very small point that I can mention. I think that's it. And the next slide, conclusion is the same thing that I have already discussed. Thank you very much.
Thank you very much. Thank you indeed, sir. I would like to stop you in the middle because the committee asked me, time's out, Mr. Paiko, and then, This sounds very nice listening your storytelling. So that's, I don't want to with give his pause in the middle of your presentation. All right. I think very interesting. After post the tsunami in Aceh, there are few people become storyteller then they're telling about the disaster and campaigning to the youth, especially with the kids, because when they don't want to be it happen again with the mass victim when the disaster comes, because you know the Indonesia is a part of the ring of fire, including the tsunami as well. So that's why the disaster will occur any time, but people need to be ready to minimize the risk of the disaster. So the storyteller is one of the ways. That's very good, I think. I call Dr. Abdis with your survey from the RCE member. Dr. Abdis is convener of the RCE Srinagar, as well as the focal point, I mean, as a, you know, as magnitude for the RCE in Asia Pacific region. That's yours. You should unmute your microphone, Abdis.
Very good morning and namaste from India to everyone. In India and in many countries, we do not have the literacy 100%. So a very big campaign, education for all. Now, considering the disasters in times to come will go on increasing, both in frequency and magnitude. And in the lines of education for all, disaster risk reduction preparedness, DRR preparedness for all, is the really key to save us from the disasters. And that is what we have been, I mean, this day today, International Day for Disaster Reduction, reminds us to reinforce our commitment that each one of us has to be DRR prepared so that we are able to help ourselves during any contingency and to help others in those who are in the need. So similarly, I mean, in India we say, Sarve Bhavantu Sukhina, Sarve Santu Niramaya. We pray for the well-being of all and everyone. Everyone should be happy, everyone should be healthy, everyone should be kind of... so similarly, but we say, DRR preparedness for all. Safety of all, everywhere and all the time. And that's what we have been promoting through RC Srinagar. We have a very distinguished panel today. We listen to the case study of Uttar Pradesh, we listen to the storytelling, we listen to the reconstruction after any disaster happens by the Kobe is a brilliant example. And we had the experience of Badoni, the head disaster management Indonesia, and also the cluster 2, which is the by Mr. Safi. What is this RCE for the benefit of the panel members? RCE is, I mean, the sustainability is breaking down. We do not have enough for our future generations. So this breaking thread of sustainability is a huge concern for everyone world over, for anyone. So I mean, the United Nations General Assembly, 2005 to 2014, this decade was declared as DESG, Decade of Education for Sustainable Development. Under that decade, the United Nations University based in Tokyo, Japan, they came up with this regional center of expertise concept. And they established world over these centers. And RCE is basically a coalition. So there has to be a center of higher learning, university. And then there are others, NGOs, CBOs, municipal corporations, whosoever is working on the sustainability aspects, get together and try to work together. So that's the objective and purpose of the RCEs. It has a mission and vision. So we have global objectives, like we have United Nations Framework on Climate Change, UNFCCC. We have Aichi biodiversity targets. We have Paris Climate Agreement. We have 10-year framework program on social consumption and production. So all these national programs and targets need to be taken down and translated to the local context where these RCEs world over has been working. And the local level initiatives, information, knowledge, experience, innovations, technologies have to be taken to the global level. To the global level, to the context of the local level where RCEs are located. And what is at the local level through RCEs is brought to the national level and the global level. So that is the whole, local to global and global to local. And that's where the RCE community fits in. And out of 175 RCEs globally, we have 38 in Africa and Middle East, 26 in the Americas, 68 in the Asia Pacific, which is the largest region, and that's why more number, and 44 in Europe. And we have been having close interaction. It started from 2005 until today, a very strong network. And all these RCs have really risen up to the challenging times, including the COVID-19 pandemic. And they have been able to address to the local challenges through the network. I've been sharing the local experiences with the global and global experiences with the level. So that's what we have been doing at the RC Community Network. Every year, we meet twice, once at the regional level. So all the 4 regions, all the RCs get together, and that has been happening for the Asia Pacific regional level meeting. We were supposed to meet in Kyrgyzstan, but because of COVID, face-to-face meeting could not happen. So we have been meeting virtually. So we decided that we will meet 4 times at an interval of a fortnight. So 3 meetings are over. The 4th meeting will be on the 22nd of this month. RC Srinagar, which was acknowledged much later in 2011, and DRR was not a theme of the RC community. We used to discuss other things, but not the DRR. So I'm very proud to say that DRR theme was introduced into the RC community discussion and meetings by RC Srinagar. And the UNEJ, United Nations University, very kindly supported my trips to Kobe twice, and also to the tsunami hit area, the Sendai, University of Miyagi, Keisei University, fantastic, soon after the tsunami in 2011. So all this, United Nations University has invested in me in building the capacity in the field of disaster risk reduction. And using that, I have been able to take it to the entire RC community at the Asia Pacific and the global level. While we were planning this webinar, we thought of getting the perception of most RCs of the Asia Pacific region. What do they feel about the disaster? What do they feel about the day today we are celebrating IDDR 2020? And what message they would like to give on this day to others. So to get that, I have, just a moment. Do you see my screen, Nico? Is this PPT on there?
Yeah, sure.
Okay. So these 3 questions were posed to all the RCEs. What immediately comes to your mind when you hear the term disaster? Just in 5 words. The second question was, how would you like to observe the day today? Just in 10 words. And what message would you like to give to the people on this occasion of the IDDR 2020? So these 3 questions in a very nutshell, very briefly, and we have got the responses from RCEs. Many of them responded to, but I'm going to present to you only some of them. This is RC Kuching, based in Malaysia, the Sarawak region. So immediately comes to tragic loss of life. Certainly loss of lives and property is the first reaction. And how would you like to celebrate? They say contemplate with peace on how many lives are lost. And reflecting on loss, let us work towards a safer future, that there are no disasters. So this is R.C. Kuching's feeling. And Hohot is in China. So, but they say is a wide range of casualty and property losses. This is when we are not prepared. And that is why the whole thrust is on DRR preparedness. If there is preparedness, the losses both of lives and property will be much less. And that is why the day today is to reinforce our commitment that we need to be DRR prepared, both at the global level, at the community level, and at the individual level, I would also say. I think this day is publicity very timely necessary. I mean, that's how all the RCs got together and we are celebrating this day. And thank you so much, everyone, joining us. All mankind should unite to cope with the disasters. Certainly, we need to. Disasters are going to happen. They cannot be stopped. It is the preparedness that is the key to reduce the loss. And this is Dobongu in Republic of Korea. We have with us the lady who wrote this, Hyun Soon B. A sudden unpredictable occurrence, that's how a disaster they see it, to prepare various scenarios for disaster occurrence with communities. Certainly, I mean, the community level initiatives are very important. And very important is the message is a disaster education system. Very, very nice idea. And it has to be in all kinds of education, right from the primary till the highest level to medical education, engineering, architecture, any education system, disaster management, disaster preparedness has to be part of it.
Can you speed up your...
This is from Greater Dhaka in Bangladesh, Save Me, Save Us, and all that. We also have it from Northern Mindanao, which is in Philippines. So that's their feeling. And this is a coastal area, so they have the floods and everything. Cebu is also in Philippines, so there are two parts. So that's their... and this is Kyrgyzstan towards the Middle East side. So that's their feeling. And then the Srinagar, where we are there. This also says every household, educational institutions and offices should have a contingency plan. We all need to have our disaster management plan. And this is to the community of RCEs. We have been requesting you to get into the disaster risk reduction preparedness. And we need to, the COVID has shown us, like, unless you get into the DRR, there is no way. Sooner or later, each RCE has to join this. And we have launched the RC Asia Pacific DRR network. So this network is at the Asia Pacific level. RCs are invited to join this, and then we really need to do a lot. That's it at the moment. And the whole global emphasis is on every country need to have a disaster management strategy and plan. Only 86 countries so far, according to the Sindhi framework. So that has to go to the entire world community. Each one has to, and also at the individual level, each one of us need to be DRR prepared. And this day is to reinforce our commitment to do whatever we can do. Thank you so much. Thank you, Iko. Over to you.
Thank you. Very thoughtful. Indeed, very thoughtful. Indeed. Okay. There are some questions has been asked in the chat box. Can Mahesi show some question? Maybe there is 2 or 3, I think. The question addresses to General Sahil and also to Mr. Ruiki. No, can I ask? Okay, can you next, please?
Okay.
Is there a question? Yes.
Your question is why housing recovery is so fast? One question. Yes.
Yeah, this question. First question is from Dr. Adil Siswanto, from as a teacher at Vocational High School in Bondowoso, East Java, Indonesia. There is a question for Lieutenant General. Sorry. is that right? Ravindra Sahil, and then to Mr. Rohiti. First question, maybe can you respond, General? I think they're on the screen, the question.
Yes.
野崎さん、さっきの話ですので。
はいはい、そうですね。はい。Yes, the reason why we could rebuild housing so fast is at 1995, at that moment, our building industry is still in better condition comparing now. That is we are lucky, I think. And the second question is, to build new house, mainly public house, disaster housing, we had at that moment a very big industrial location. And just after earthquake, just before earthquake, very big heavy industry relocate to the other space. So we have a very big building site. That also a very for us it's a very lucky point. Yes.
Okay, I think that question which is there on screen, that what is the most important thing that your country should do in reducing the disaster risk of COVID-19, as well as how to prepare economic sustainability after the disaster. Part of this was also covered by me in my communication earlier. However, I'd like to reiterate that at the national level, the broad parameters of the economic revival have already been laid out. Therefore, I'd say that a national strategy is required to ensure that and lay the guidelines for the economic activity to kickstart. Having said that, what is required at the grassroots level is the community participation. It is the integration of the strategy at the national level, which has already been outlined by the Honorable Prime Minister, and the economic activities have already commenced. And now the community has also understood the requirement. And while we deal with the pandemic, I think the kind of mobilization which has taken place in all planes, whether it is the manpower, whether it is the economic boosting of the economic activities, or the other available parameters, are only leading to the economic activity to kickstart. The migrant laborers which had returned are being sent back after having developed their skills in their own capacity building has taken place. And that is the single most factor that at the national level, the strategy has been drawn. And now it is being supported duly by the community, by all the states, and by individuals, by ensuring that everybody becomes part and parcel of this revival of this economic activity. Anything else would you like me to cover?
Very much.
In short, I can say that while we deal with COVID-19, by developing the infrastructure, the economic activity will continue, and we deal with both the pandemic as well as also the revival of the economic activity at all levels, starting from the village and right up to the national level, or top to bottom or bottom to top. We have integrated each and everybody, and the effects will be seen in very near future that the Indian economic activity has actually been able to sustain the damages which were caused due to the pandemic. Thank you.
Okay, thank you. Thank you very much. We have actually special guest this morning. I call Mr. Igarashi San from Chiba University, who actually engaged in what you call it Japan. Sorry, I forgot the Japan Disaster Emergency Agency, or GDMI, or it was called it UNEJ, as a volunteer in the national level as NGOs, and he involved in many kind of planning in Indonesia with the Tagana, with the Ministry of Social Affairs. Okay, maybe you have 2 or 3 words can be, you want to say in this forum? Igarashi-san?
Yes, Eko-san, thank you very much for your kind invitation to the seminar today. And I'm so sorry that I haven't prepared any presentations or any sort of material to show. However, I wish to share some of my comments with you all and see how you feel and how we can integrate our efforts to a common goal. My name is Igarashi, actually transmitting from Chiba province, Japan. It's a little bit far from Tokyo, but still Wi-Fi is fine here. My expertise is emergency management. When you talk about disaster management, there are 2 perspectives. One is the risk management, and another one is crisis management. These 2 are brothers and sisters, but when we talk about the disaster management in community, I trust that these 2 approaches are kind of necessary to take into. As you know, the risk management is to assess the risk before a disaster happens and take necessary actions so that when the impact occurs, you will be better off. That's sort of the risk management that we have been talking about. Now, crisis management is something that I'm expert in, is how we deal with the situation when emergency occur effectively, efficiently, and timely manner. And we study and take all the necessary good practices into one common understanding. This is what we call crisis management. But when we talk about community level activities, I am learning many different cases presented by presenters today, and I'm learning so much, and thank you very much. Now, I think what we have to have is the connection between the risk management and crisis management together. A disaster happens anywhere, anytime, and we do not know. We don't know when. We don't know exactly how big that, say, earthquake happens. We don't know. So there is always limitations in our sciences. It doesn't tell when, where, and how that disaster can occur. So the DDR, we focus on risk management, which is fine, and we have to do that. But at the same time, we have to learn how to deal with the emergencies when it occurs. And we're not really good at it. We have a contingency plan. We'll make it before the disaster happens, based on all the survey, plan, all kinds of things, which is good. However, once the emergency takes place, sometimes that contingency plan is not working. And this happened to us all the time. For example, 2011 March, in the eastern Japan, you know, the tsunami earthquake. The contingency plans and government capability are all down. So we have to, at the community level as well, we have to know how to deal with emergencies. I'm sorry, just because I'm expertise in emergency management, I teach at the college emergency management. But still, when we talk about disaster risk reduction, we're going to have to integrate crisis management concept into the whole picture. And as you know, government has limited resources, capability, and capacity to respond to all emergencies. Now, who has to be ready? That is myself, yourself, community as a whole, and then combination of government agency support with our self-help supports. It has to be combined at the right time, right place, and right way. So this is something I wish to tell everyone, that the DRR, when we talk about not only the risk management, but also the crisis management, should be integrated together. And once again, our contingency plan sometimes may not work. Then how do we deal with the situation at the community level? One good example I can introduce is Tagana activities in Indonesia. The Tagana, as mentioned by officer from the Kementerian Sosial, said that it goes to community. And Tagana teaches risk management and crisis management all together to community. I think this risk management and crisis management, both concepts has to be integrated in together and then put it into the community at the practice. It must be very important concept. And I'm sorry, just because, once again, I'm expertise in emergency management. I've been in the 40 years responding to 5,000 disasters, Africa, Asia, and the South, and also Central America. From that experience, I must say that not only the risk management part, which is we do before disaster, but we also have to be capable enough to respond to emergency. That is my comments, and I don't want to take too much time, but once again, I have learned so many good things from all the presenters today. Thank you so much.
Thank you very much, Mr. Hitoshi. I'm sorry, Pak Eko has lost connection to the Zoom, so I'm going to take over for a while.
No problem.
Yeah. Arigatou gozaimasu. Is that correct?
Terima kasih.
Terima kasih, sama-sama. Okay, so I believe that we are going to move on to the next question. Okay, so the question is from Nurzafila. Okay, so upon the disaster storytelling, what are the lessons learned and how the existing communities responded to prevent and reduce the potential disaster and prepare themselves to become more resilient? Okay, so I believe that these questions is should be directed to Mr. Yoshinobu Fukasawa.
Yes. Okay. Thank you for the question. The storytelling is a spontaneous expression of what a person felt when he or she was undergoing the difficult situation. And it is not that he wants to teach something to other people. He simply would like to voluntarily share his emotion, his what he felt. And that is basically a small thing, for so to speak. Suppose that the person lost one of the family members because of his slow response, then he regrets very, very strongly, very, very badly. He simply, so the information that you can receive from that sort of storytelling is not a big one, it's a small thing, which cannot save you from disasters anyway. But I wanted to stress that that is still, when you are exposed to this kind of storytelling, you also feel very strong empathy and resonance in terms of the emotion, which pushes you to implement what you already know. You know, the knowledge, more or less we know, no? The guidebooks are there all over the place, and the seminars and the schools and everything. You learn things and you know the knowledge and information and the theory, but you don't practice that. The one of the pushing forces is storytelling. That was my point. And so, therefore, I think I stop here. I hope I was clear. Thank you.
Okay, thank you very much, Mr. Fukasawa. And I believe that Pak Eko is back to Zoom, so I'd like to hand over the forum for him again. Pak Eko, are you there?
Yes.
Okay.
Yeah. Okay. So I'm sorry for the
It's all right.
the accident. Okay.
Yeah,
Let's continue with the next. I would like to call the last speaker to have a concluding remarks. Mrs. Byun from Korea.
Yes. Can you hear me?
Yes, we can hear you.
Can you hear me? Okay, thank you. Good morning and good afternoon. I am the Hyun Sun-bae, Director of RCE Dobonggu in Seoul. Thank you so much for inviting me to on a meaningful webinar. Today, there were good discussion about disaster risk reduction, the preparedness, COVID-19, and the sustainability for the IDDR. So the four experts on this subject, they gave us the important messages. The first, the JNPR side, the talk about and yes, the DDR, the policy and the initiative in the community. So having the experience in the numerous disaster, the India, they recognize the importance of strengthening the DRR, the efforts, the bird considering the nature, the economy, and the social diversity of India, as well as its large population, introduction to DRR in India, the current the scenario of DRR in the India, creating the national capacity, the building the program for disaster risk in that, the huge challenge. So the India has there has been an activity that pursuing in the paradigm, the shift in the disaster the management, from the relief, the centered approach, to the holistic approach. So the encompassing or the facet of the disaster management. So the GMPR, the size of presentation, so we learn to need a greater leadership in the difficult times. And the second, the Mr. Nozaki, from the Kobe, Japan, the talk about the people's initiatives for the DRR in Kobe, especially the earthquake. So since Japan has got the biggest metropolitan disaster, so they try to the rebuilding to the central power and they keep the local initiative with the local government, the university and the college, and then specialists and the researcher and the citizens. Kobe makes on the effort to build a disaster risk management and then show the activities like organize a civil organization and then relocation the meeting and then learning from the best practice area and the supporting group is a change. So about the master on the Wajaki's presentation, so we are able to learn about the importance of people's initiatives. And the third, Miss Inhas Kuanahi, from the Indonesia, she talked about the supporting the community in the disaster risk reduction or the people-centered approach. So it impressed the most as a policy 5 direction of disaster management. And then she also talked about the campaign the Benkana is a disaster the prepared village. And in the activities like capacity strength, and then guidelines to the support to community the initiative, and then system and the hub of information or the response for the COVID-19. So through the campaign, the Shagat Benkana, so we understood the importance of the building of the disaster prepared village, and then how to we know that about the solidarity. And then third, Dr. the Fukasawa, from the Japan, that talk about the disaster, the reduction and the human renovation in Japan, like a disaster, the storytelling and then telnet. The disaster telling is a significant the issue to discussion. And then it is important to get knowledge for the practicing Kobe practicing so it supported those in the exchange and then crossing learning across the boundaries, and then appealing in one voice for the importance of such conduct of telling lives lessons, and then contributing to the creation of a disaster resilience to the societies. So about from the Fukasawa's presentation, we will be able to adapt the disaster storytelling to local community that based on the local characteristics. And then we also, the Dr. Abdesh introduced about the research of 3 questions from the RC families in IP. So each of the RC, the cities has given interesting answers. So through this survey, we found that more the diverse approach to DRR as we need. And then after we are through the questions and the answers and about the DRR and then DRM, so we was able to learn more the in-depth content. So DRR is the part of a sustainable development. So it must involve very part of the society, the government and non-governmental organizations, and the professional and the private sector. So therefore, the request in the people centers and the multi-sector approach, the building the resilience to the multiple and then category and interacting the hazard and creating the culture of the prevention and the resilience. So it is this webinars highlight that point. So lastly, I would like to summarize today's webinar with this purpose. We needed to saving lives and the livelihoods through the power of solidarity. Thank you.
Thank you very much. Thank you very much for all speakers who participate today. That you already gave us inspiration with the wonderful thoughts. Thank you for General Sahil, Dr. Abdes, Mr. Fukasawa, Dr. Yun Sun Bai with the concluding remarks that we just heard, and then Ibu Ida Kurniasi from the MOSA, and Mr. I forgot the name, sorry, from Kobe. I tried to remember, but because I lost connection, I lost my notes.
Ruchi Nozaki.
Oh, yeah.
Ruchi Nozaki.
Thank you very much. I think that's all, guys. Thank you for your joining the IDDR. The conclusion is on your hand right now, because we are listening the experience from north to south, from west to east. I think this is the most important thing that we should think. We should keep in our mind that sustainable development is kind of our theological dreams. As long as we can achieve and we can working in the principle of sustainable development. I give back to the announcer. Sorry, I take the last session because the interrupted by the technological problem. So,
okay.
Sorry, Ibu Fitria.
Okay, that's all right. That's okay, Pak Eko. Thank you very much, Bapak Eko, and all dignitary speakers for the very inspiring and insightful and informative sessions. Okay, let's give a big round of applause for everybody who has given extraordinary address in the session. Okay, thank you. And Excellencies, honorable guests, and ladies and gentlemen, our next agenda is going to be a vote of thanks that will be delivered by Bapak Honesto Dimolasi of RCE's Java candidate, and he is also one of the senior lecturers of International Relations Department of the Faculty of Social and Political Affairs at the University of Jember. Time is yours, Pak Hones. Okay, is Pak Hones with us?
Honest with us, Regina?
Honest are you there? Or maybe while waiting for Pak Honest, what about us having some photo sessions? Okay, so maybe Mbak Mahesi and Mbak Regina, you can help us take picture of the pages on the screen. If you could help us. Okay, yeah. Okay, so well, ladies and gentlemen, because we are not going to know in which page we are going to be in, so let's give our big smile, okay, like throughout this photo session, or maybe Regina, you can make like equal. Okay, I'm the co-host as well. Okay, I'm going to make it into gallery view. Okay, Regina, are you taking the photos? Yeah, okay. Okay, please please turn on your camera so we can see your faces, like for those who have not.
Okay, done. Next.
Yes.
Ready to know?
Okay, are we done, Regina? Yes. Okay, that means yes. Okay. Okay, well, thank you very much, ladies and gentlemen. Thank you very much, Regina. And now we are, maybe Pak Honest, are you there? Pak Honest?
You can representing Pak Honest.
Yeah, pardon me, Pak Eko?
Maybe you can representing Pak Honest.
Oh, okay. Okay. So, well, so on behalf of the committee, okay, so we would like to extend our, wait a second. Okay, so on behalf of the committee of our international webinar today, I would like to extend our heartfelt gratitude for all of you for your kind participation in our webinar today. Thank you very much for all excellencies, dignitaries, distinguished speakers, and honorable guests, and every single participants. And I believe that as myself, we have learned a great deal from this webinar. That has been a great sharing session, and that we all wholeheartedly hope that the pandemic will be over very soon. And we have learned from each other. And hopefully we will all regain our freedom to achieve our dreams and probably objectives that may have been currently restricted by the pandemic. Okay, so to conclude, we wish you all a very good health. And once again, thank you very, very much, and see you in our next webinar series. Okay, goodbye for now. And wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you. Thank you, everyone.
Thank you very much. Okay.
Thank you.
Domo arigatou gozaimasu.
Thank you, B.
Thank you.
Thank you.